En el estado de Connecticut hay un servicio que el Departamento de Servicios Sociales, o como le dicen el State Welfare, o a veces le dicen el Bassett Street. Las personas pueden llenar una planilla la cual le da seguro médico si tienen el ingreso necesario para ser elegibles a recibir seguro para su niño, o si es una señora embarazada o una mujer embarazada. Por favor, no se nieguen a buscar servicios médicos sin antes primero buscar información de seguro médico. Le voy a dar un la. Hay una línea que se llama Infoline, es la línea de información. Usted marque el 211 y esa persona que contesta la llamada va a dirigirlos a ustedes a un centro de salud, la cual usted puede aplicar para seguro médico para usted, sus niños o sus seres queridos.
Gracias. Now, when someone comes to the primary care center and that person has no health insurance, do they get seen?
Yes, yes. I mean, we never say we're not going to see someone because they don't have health insurance. Yale New Haven Hospital has a unique program called Free Care, and a lot of people access free care through being seen in the emergency room, and that's actually how we get a lot of our patients at the primary care center initially seen. But basically, it's a program that where the hospital will get a reimbursement from the government, but basically all your hospital visits or your hospital-based visits will be free of charge to you. University services may have a fee apart from the hospital because it's a separate entity, but
yes, so like the doctors who are actually employees of the university,
right?
They will bill the patient,
right. So, but that applies more to specialty care rather than primary care, because those of us in the primary care center are under this program are covered, and so we would be able to see you under free care. And we have a lot of people who are not documented or don't have insurance for another reason, and a lot of people get seen through free care. In order to qualify for free care, you have to have applied to the state insurance and get denied, and then you can get free care for 6 months. And then if you have ongoing health care needs, then you can apply for free care again for the next 6 months, and so on.
Okay, so I think we need to explain that a little in a little more detail.
What the hospital has done that is a wonderful service is to provide free care or reduced services. So the hospital staff mails an application to the patient who has an outstanding bill. The individual is informed exactly. It's a simple application. What steps to take, what documentation needs to be attached. One of the documentations that needs to be attached is a denial from the Department of Social Services.
I see. So the person needs to apply to social services. But again, Vivian, what about those people who can't write to fill out the application? Who do they turn to?
Okay.
Because if they can't apply, then they can't get the denial.
What occurs is that the hospital mails to the patient a letter in Spanish and English indicating this is the application process. Throughout the community, people know they can come to Fairhaven Clinic and we'll assist them.
Okay.
Also, Junta, Central San Jose.
Yes.
We network with people in the community.
Oh, yes, we need to know that. So Junta and Central San Jose are places in Fairhaven that people can go to get help if they don't read and write.
Correct.
Well, that's so important to know that people, if you cannot read and write, there are two places in addition to the Fairhaven Community Health Clinic. There's Junta and Central San Jose,
and the churches in the community.
Oh, and there are also churches. So you can go to many of these places and ask for help. So the fact that you might not be able to read and write in English or Spanish is not a reason not to seek help. But also you can ask your neighbor. If you have a neighbor who reads and writes well, you can ask your neighbor for help. If you have children who are in school who can read and write, and many children, Hispanic children, are bilingual, they can speak and write in both English and Spanish. But get the help you need, because one of the things we want to stress is that the emergency room is not the place to get your primary care. It is not the place for a lot of reasons, mainly because they cannot provide you comprehensive care. They cannot provide you follow-up care. They just deal with crises. So every time that you're sick, you only go to the emergency room when you're in crisis. There's no follow-up. And so I want to ask anybody here to talk about the need to have good primary care, to have a provider the way Fairhaven has this comprehensive thing, as opposed to just going to the emergency room. Talk about some of the problems with just going to the emergency room.
Well, I think a lot of emergency room care can be redundant, and so you can see someone getting an MRI for low back pain over and over again. And maybe that's not such a great example, because the emergency room is not going to do an MRI, but or for headache, for example, getting multiple CAT scans and so forth, when all that may be going on is depression, and people may be having headaches due to stress. So I mean, that's where the primary care provider can really put complaints into context and really avoid sort of this rushed care that the emergency room really doesn't have a lot of resources to give comprehensive care, nor is it their role. They're there for urgent care, but it's really hard to provide really great urgent care if you don't know the person, if you don't know their context, or if you don't know what they have been through. And the primary care provider is someone whom you've established a trust relationship, whom you have confided things that you would never tell an emergency room provider, and so that can only enhance your care.